light and Resus.
Staff nurse Ellie has been qualified working at Northwick Park Hospital for 4 years.
My job in particular as an A&E nurse, I love the unusualness of, I don't know what's coming through, it's exciting. I know it feels like you can't breathe, but I promise you it's going to make you feel better. Also, the really, really funny people that I meet, people with really great sense of humours, they're so kind. All of it together is what makes being a nurse.
In her time at the hospital, Ellie has become part of a closely knit team of nurses.
Gemma, we're going to have a lovely night.
What have you taken?
Right.
They're all friends, whether they're in or out of their scrubs.
Are we ready to slap some balls?
I've made some really, really amazing lifelong friends from working in A&E. Ruth, Kevin, Heather, Anne-Marie, Nikita. We see each other often. We go out partying together. We have a laugh inside of work. Even if we're stressed, we have a laugh outside of work. It is 100% a work family. I will go in.
Who's leading?
For the last year, she's not only been saving lives on a daily basis, but also planning a wedding.
First taste of our wedding menu. We're definitely having this.
It's absolutely beautiful.
Yeah. Cheers.
Cheers.
I've always wanted to get married and I'm very happy. We hadn't really discussed it and it was a big surprise. He had obviously been thinking about it and he had rang my parents to ask them and I didn't know anything about it.
Ellie will be marrying fiancé Shane.
Me and Shane met on a night out. We have been together since my last year of uni.
It's going to be a good day.
And everyone's going to be around us. And I just think it's really exciting.
I can't wait to marry you.
He is amazing. He is the love of my life. And he makes me smile every day.
The big day has arrived. And best mate from work Nikita is on hand to help get her ready.
You know, there's a reason that these nails
Just watch
are fake.
your chin, please.
Yeah.
Oh, no, let's do her face when she's getting married.
It's lunchtime somewhere. It's fine.
My role in the wedding is basically I'm going to have like a little emergency bag just in case Ellie needs like anything, like a touch-up of any makeup, perfume, whatever, helping her go to the toilet. I'm in charge of doing the breakfast in the morning, I think. Just getting a few bits and pieces and champagne and stuff and just making sure Ellie has a good time and she's not under stress, I guess. Your bracelet.
So, the girls got me something blue, which is very cute. And then we got my lovely bracelet. So beautiful. I'm really, really looking forward to my wedding, sharing that day with Shane, but also having everybody there that we love. Oh, hiya, I'm ringing from the bridal room. Would somebody be able to drop a Prosecco glass down to us? We've just broken one. Thank you so much. Yeah, adult blue light, amber Resus, 10 minutes.
But Ellie isn't the only one dealing with affairs of the heart today. Nurse Claire has been called urgently back to Resus, where an 80-year-old man, Michael, has been brought in with an extremely high heart rate.
So these are all the ECGs from the ambulance. So they brought him in because he was in VT, ventricular tachycardia. This is a normal strip, whereas you can see here, like, this isn't normal at all. This is just up and down, so it's quite dangerous. So if these were prolonged, then it could eventually go into a cardiac arrest. So yeah, that's the last thing we need. Okay, let's have a look at them veins, all right?
Yeah.
You put this down.
Take my pick. I will. Hopefully I'll do better than this side, eh?
With his heart rate alarmingly erratic, it's essential they get medication on board as soon as possible. But the first hurdle is getting access to a vein.
Getting a vein is very important because you need to give them drugs if their heart rate is too high or too low, to give atropine or adrenaline or anything, all the essential medications. Getting access for an elderly patient can sometimes be quite difficult because they're a bit more shut down and their veins are harder to find. It's a lot easier. We have nice veins. You can see the vein straight away, pop a needle in, you got the blood flow, no bother. But for elderly, unfortunately, it can be a lot harder.
There you are.
We got the blood.
Despite his serious condition, Michael is taking it all in his stride.
I'm going to leave the cannula in your arm, Michael, and we're going to give you some medication to calm down the heart rate.
As I said, I did take aspirin 4 hours ago.
You did, when the chest pain started?
Aspirin, about just over 4 hours ago. Either that or whiskey.
I wonder which one's better.
Yeah, I know which one's better.
You know which one you prefer anyway. Is that it?
Right.
Chatty patients are always good. Doing a cannula or anything else, it's nice to just be chatting away to them, distract them, ask them about their lives, their family, and just, it also gives a good rapport with the patient so that they'll get on with you, they'll trust you more and everything.
I just off a rhythm strip for him and just keep printing it to see what he does over time.
No problem.
With the cannula in place, Dr. Fiona has come in to see which meds will relax Michael's extremely dangerous runaway heartbeat.
Let's give him some magnesium.
I'm not going anywhere.
No, I don't think so.
Not with this ECG, not.
At least I don't think so.
An injection of magnesium into Michael's cannula should reduce his heart rate.
Tachycardia in the elderly can be very dangerous. Your heart automatically gets weaker as you get older, so having that increased stress on your heart, it's not good for any person of any age, but especially for the elderly because their heart is already weaker.
Do you feel your heartbeat doing something funny?
Not now, but when it does happen, I can feel sort of palpitations of fluttering.
Yeah, well, it's doing it quite a lot.
Is it? Oh, I must be getting used to it.
All right, darling, I'm back. I've come with some magnesium.
Tachycardia can be induced by a lot of things as simple as just exercise. Any extra activity within the body can cause your heart rate to increase.
Okay, I'm just going to put a bit of tape around it, but just be very careful with it. 'Cause that's very important.
I won't move, I promise.
Keep that arm straight.
I could feel something going through my veins because the sort of, I can feel it in my ear and my head.
Do you feel funny? You feel okay? No?
I can just feel something going
Okay.
through.
All right.
Somebody must be happy.
Something's happening. Hopefully it'll settle that heart rate of yours.
Magnesium should block calcium in the heart, allowing muscle fibres to relax, reducing the risk of cardiac arrest.
If someone comes in with a high heart rate, it can be quite scary for us and as the patient, because with a high heart rate, it can lead to a heart attack, a clot being thrown out, or eventually a cardiac arrest, unfortunately.
Hey, it's Ramika. I've got a patient for Darwin C4.
Nurse Ramika has been working at Northwick Park Hospital for 16 months.
I love everything about my job. Literally, my colleagues, my patients, the experience, the exposure that we go through, which helps us get different skills to enhance our knowledge.
HDU 15. He's stage 3 brain tumor, unfortunately.
Reason why I went for A&E is because we get to expose in every field, not just in medicine, but in orthopedics or surgeons or gynae. There's lots of variety of cases that come into A&E, which is quite interesting.
It's not just a wide variety of medical cases they see at Northwick Park, but a wide variety of people, all from diverse backgrounds speaking different languages, which can make things tricky for the staff.
When you're unable to communicate with the patient, it does make our job a bit difficult.
But luckily, Ramika is from Sri Lanka and is bilingual, being fluent in English and Tamil.
Knowing another language makes it quite useful in our job because we have patients who have language barriers who are unable to communicate with the doctors, their needs. So I'm happy in a way to be able to go and help them out.
He said that he's feeling a bit dizzy, he's unable to walk around, he's quite imbalanced.
Ask him if it's a steady feeling or does it come and go?
அது உங்களுக்கு போய் வர்றதா இல்லாட்டி அது வந்து ஒரு கான்ஸ்டன்ட்டா?
இல்ல அது அப்படியே இருக்கு இப்போ. இது கொஞ்ச நாள் அப்படியே இருக்கு. குறையது இல்லை. இன்னைக்கு தான் ஓடி நான் வந்தேன் இங்க.
இப்போவும் தலை சுத்துதா உங்களுக்கு?
இப்போவும் தலை சுத்துது.
So he said this dizziness is an ongoing thing. It's not intermittent, and he still feels dizzy now.
Northwick Park Hospital serves one of the most ethnically diverse populations in the country, with 69.1% of Harrow's residents from diverse backgrounds.
The people who live nearby Northwick Park Hospital is actually quite diverse. I always love interacting with them because they feel like they have someone to talk to.
So for the past 3 days, he's been having vomiting as well. That's one of the other symptoms he's been having.
Vomiting?
Yeah.
Ask him how many times in a day he vomits.
ഇപ്പോൾ ഒരു നാளைക്ക് എത്ര തവണ സത്യം എടുപ്പീങ്ങൾ
ഇല്ലെങ്കിൽ 4 നേരം കൊടുത്തു
നേറ്റ് മുന്നനാൽ
നേരത്തെ മുന്നേ 5-6 നേരം കൊടുത്തു
Today 4 times, but yesterday and the day before was approximately 5 to 6 times.
Ask him if he had a stroke before.
இதுக்கு முதல்ல உங்களுக்கு ஸ்ட்ரோக் வந்திருக்குதா?
ஸ்ட்ரோக் வந்திருந்தேன் நான்.
எப்போ வந்தது உங்களுக்கு?
10 வருஷத்துக்கு முன்னே.
2012
அது நான் இங்கே வந்து இருந்தேன் 6-7 நாள் இருந்தேன்.
So he did have stroke previously, approximately 10 years ago, and he was admitted here for approximately 6 to 7 days.
Okay, thank you very much.
Taking a patient's medical history is one of the most important things to do when assessing a new patient.
Thank you.
Communication is a very important part of our job. Without communicating, you wouldn't be able to get the adequate treatment for our patients.
I tell you, the magnesium, I think it's having a slight effect.
That's good.
I'm sort of relaxed.
Yeah.
Nurse Claire is trying to manage 81-year-old Michael's ventricular tachycardia, an extremely high heart rate, with drugs prescribed by the doctor.
Next up is some amiodarone.
Some what?
Amiodarone, it's called. So it's just another one to help relieve the heart and get it pumping back to normal.
Your heart, to begin with, in a normal healthy person will be in sinus rhythm, but when you're having heart palpitations, your heart rate is going super fast, so it's also tachycardia, but then it can also throw out these extra little beats, which is very dangerous. It can also throw out a blood clot and lead to cardiac arrest. It can definitely be fatal for elderly people.
I'm just giving you some fluids now. Keep you hydrated.
Okay. I've got a bottle of water.
Yeah, well, you can drink that as well. Alright, so there's just a litre of fluid going through there. Keep you nice and hydrated. You feel okay?
A litre of it.
A litre, yeah.
It can be difficult to bring a patient's heart rate down. Sometimes patients just don't respond to the drugs that we give them, which can be quite dangerous. So then if the intravenous drugs or oral drugs do not work in bringing down the patient's heart rate, then it'll essentially lead to us having to cardiovert them.
Cardioversion is a dangerous procedure where the heart is electrically shocked to reset it, and the last resort, especially for a patient in their 80s.
What beats having cancer?
Well, there we go. That's one way to look at it, I guess.
Having got through 2 of those.
You had cancer in the past?
Yes, twice.
Where?
Bowel cancer, high anterior section.
Oh,
that
wow.
was 8 years ago, and bladder cancer.
Oh my God.
2 years
You've
ago.
had the whole works.
While waiting for the drugs to take effect and hopefully bring his heart rate down, it turns out Michael's no stranger to hospitals.
But I think doctors can only help.
Yeah.
The patient has got to want to survive.
Yeah.
Give a positive attitude.
Mind over matter, eh?
It really is.
Yeah.
And you're going to get through it.
Yeah, definitely. Think positive.
I love caring for the elderly. The way I put it is like, oh my God, like this could be my mum. And I'm just, when you put it like that, you want to give them the best care possible, and you just want to like make sure that they're okay.
Hopefully the medicine will relieve Michael's heart issues. Until then, he needs to be closely monitored and made as comfortable as possible.
You have a sandwich. Do you want a cup of tea?
If I'm allowed.
Of course. No problem. Got milk and sugar?
No sugar.
Black tea?
Just black tea.
Easy.
We can have Red Bush even better.
No, I'm afraid not. We're not that good. Nice cup of tea.
The elderly are so sweet and lovely. I always try my best to offer them a cup of tea, sandwich, anything, just make their life a bit easier. I mean, it's not nice being stuck in A&E.
All the staff here are excellent. In their job, they can't afford to make mistakes. You know, you can't rub it out and say, no, I'll start again. I think they're fantastic in that respect.
Here you are, darling. Tea bag in or out?
You sure can have that, because that's caffeine loaded.
Yeah, it's all right.
I don't mind. I'll take it.
It can take it. Let me take that off. So you can actually enjoy it, all right?
Thanks.
Hey!
Anyone else need a top up?
Yeah.
Nurse Ellie is getting ready for the big day, and some friends have popped in with some Dutch courage.
Are you a bit early for a shot, isn't it? No, get a shot into that glass and down my gullet now. Thank you very much.
Oh,
is it Ellie?
Happy wedding day!
These are lovely.
Because of my job, you learn what is important and what you actually need to worry about and what you don't need to worry about. Getting married is supposed to be the most amazing day of your life, so why ruin it with all the nerves? I'm full of excitement. Oh my God, they look amazing.
Right, your bouquet's there. I'm holding it underneath here because it's a handle.
Okay.
So it's
going in.
Box. Yeah.
Oh my God.
Yeah.
All matching.
They're so good though, aren't they?
Thank you. Oh, I'm so happy. Thank you so much.
Ellie is doing just fine. We deal with stressful situations all the time, so it's just sort of second nature, I guess. I think once she's got her dress on, she'll have a bit of nerves.
No bride's big day would be complete without the dress.
It just feels amazing. It's so sparkly, but it's not too much. I love the lace at the top, and then it hides all my lumps and bumps, which is the most important. Can't wait to put it on. It will be a little bit strange wearing a dress today. Not what I'm used to because of my scrubs. I definitely won't be getting any blood or body fluids on this today. My dinner maybe, but...
I absolutely love the dress. It is perfect just for Ellie, you know, it's got enough sparkle, enough puff. It just fits her so well. I can't wait to see it.
But we all have hair like mine. It'll wear it back.
Please.
Yeah.
While Ellie is cool as a cucumber about her nuptials, doesn't mean everyone is.
Shane's at home being sick.
Yeah. Oh no.
Yeah, Enda just told me that he's at home and he's puking.
Oh God.
Shane.
Oh no.
At least there'll be a nurse or two on hand when he arrives later.
No more palpitations?
No.
No? You sure?
Yes. The fact that I had to think about it should be...
Yeah, exactly. Your heart rate is 70 at the moment. Much better.
Of course it is. The drugs are on.
Just sit up a little bit.
Nurse Claire has given 80-year-old Michael medication to reduce his rapid heart rate.
Sometimes I'm like, holy crap, like this person's life is in my hands right now. So yeah, it's quite a scary experience, but rewarding when they come out the better side.
What was the blood pressure?
126 over 87.
126. It's never been that low.
You're in the prime of your life. It was 150 when you came in, so we're getting lower.
I feel better already, yeah?
Good. We'll have you out of here in no time, eh?
Another 6 hours in no time for you.
Not only is Michael's heart rate stabilised, his blood pressure is a better level too. Now he just needs another ECG to get a clear bill of health.
Right, let's do another one.
Yeah,
and then we'll see the difference in your heart rate from when you came in to now.
I'll take it. All
This
these
is the
things are
fun part.
colour-coded round.
Yeah, all colour coded. These ones all have little numbers as well. No, I could do it in my sleep now. I've done them so often. You're not having any pain now at the moment, are you? No palpitations? No? Very good. Let's not jinx it, eh? Big difference. Much better.
Like a plateau.
This was the first one, which was a bit haywire, gone a bit crazy, and then it's much better, all settled. That's after all the medication has been given, so great effect. You don't need to be in Resus anymore, which is good. So you're going to be stepped down, so you're moving in the right direction. Yeah.
It is rewarding knowing that you do save people's lives, essentially, at the end of the day.
And then I'm going to take these ones off. Oh, sorry. Good job, you're not too hairy, eh?
Last week, everyone in the A&E department was caught off guard when a baby was born in the loo. No one was more surprised by the new baby than staff nurse Lou, who was on his last ever shift in the emergency department.
So there we go. This is where we were all trying to revive and resuscitate the baby. It was a crazy scene, actually.
Mum Laline had absolutely no idea she was pregnant.
At least the baby's fine.
And neither did her mother, new grandma Sumra.
She had taken her pregnancy test, it came out now, and then she went to the doctors and they said nothing. She was taking birth control tablets. This is all miracle.
Today, they're back with new baby Mohammed Ibrahim and have come into the department to say thank you to everyone who helped them and to have a few pictures taken for the local paper.
Doctors are considered to be the lifesaver after gods, and this is true. To me, they are angels. Thanks from all the family members to all of the staff of A&E. They did incredible job. I think almost all of the staff of A&E was there. They were comforting my daughter, they were comforting me, they were looking after the young lad. They are superheroes. They are really, really lifesavers. I pay my heartily gratitude towards the staff of A&E Northwick Park. Thank you very much. Loads of respect and love. Honestly speaking, from the core of my heart, credit goes to all of you. Because the way he was born, the way he was into the toilet, into the pool of water and blood, it was beyond my thought that he'll survive.
But the most important job was yours. You did everything. That's impressive. Can you believe this? No one goes through this on their own usually.
That, you know, it's just help and support and everything that.
Yeah, it's not.
I'm just so grateful for right now.
Good.
I was just thankful to the hospital staff, midwives, whoever it was involved.
She did all the work to be fair.
Thank you.
Sounds like you both worked really hard.
The only person not available to be thanked is Nurse Lou, who is catching his flight today to move to the USA.
A lot of things really are going in my mind right now. I'm feeling quite emotional actually, thinking like last night was my last night here in London.
The day has come for Lou to pack up his things.
Good thing about it was I did not have to spend it all alone because my friends were here to give their last goodbyes and all those things, so that's very special to me.
And he's taken a little bit of Northwick Park to America with him.
So this is like my jumper at work. I'm quite sentimental, so I would never leave it behind.
Once packed, Nurse RJ and his close friends will take the trip with them to the airport.
Have you packed everything?
Yeah,
Your
yeah.
passport?
Yeah, the most important thing that I've packed first is my passport. I think it's harder for me. These people are like a family to me. They're like my siblings. So that's another thing. That's the most difficult bit here of like leaving them and all. And that's it.
He's such a pro.
Of course.
You know the feeling that you're actually saying goodbye to a really close friend, like a brother to you, and he will be like 1,000 miles away from you.
Are you just imagine if you left everything, I will go crazy.
Lou has booked a minibus to Heathrow Airport so everyone can go and wave him off. It's going to be an emotional ride. Fingers crossed they can all hold it together.
Are you all ready, guys? I love you all. Just want to say I love you all. Goodbye, Harrow. Bye, Harrow. See you soon.
Nurse Lou has been working at Northwick Park Hospital for 7 years, but is now heading to the airport with colleagues who are giving him a big send-off as he moves to the USA.
It's happening. I'm not leaving because I'm going on a holiday, but I'm leaving because I'm going to head to a new life. Let's go, guys.
May ganda, ingat ka. So this is it. This is the send-off.
It's time for his final shower of hugs to say goodbye. Not only is he leaving behind his friends, he's leaving behind his brother Louis.
I'll see you, everyone. I'll see each other. We'll see each other soon. So yeah.
In the interest of safety, parents were evacuated.
Bye, everyone. Just let me know I have to reach Harold.
Bye.
If this is my wedding day, I'll be getting sick. Nervous pills.
Ellie is now in the hot seat, getting glammed up for a big moment.
I don't think any of my patients would recognise me. Sometimes I don't brush my hair when I'm going to work. I just put it in a ponytail and I get there on time. Even outside of work in my CVs, I don't think they'd recognise me.
Ellie already has hospital mate Nikita with her for support, but the other emergency nurses have started to arrive.
I've seen the dress. Have you seen the dress?
Have you seen it?
Yeah, I saw the dress. Yeah, she looks lovely. I don't think it's what you expect from her, but it looks really good on. I was like, oh.
Her nan gave her quite a bit of help with it, didn't she? She kept
Her
it
nan's
for
a
her.
seamstress, isn't she?
Yeah.
The nurses, they're all coming. The majority of my bestie ones are coming for the day. Ruth, Nikita, Kevin, Heather, Anne-Marie. It's an unexplainable bond between us because we see such horrific things that you couldn't even begin to explain to somebody who didn't work in that situation.
Nikita sent me a picture because she was getting the back done and the grandma was like...
You're supposed to be giving spoilers, it's the wedding.
It's a bit more glam today than the usual scrubs, and I'm not covered in vomit or blood or anyone else's body parts, so that's good.
Me, Ellie, Kevin trained together. I've worked in A&E, which is a trauma in itself. It's kind of nice that we did the whole journey and now he's getting married.
I'm delighted to be here today. I'm genuinely nervous myself for Ellie.
I feel nervous. I don't know why I feel nervous, but I feel a bit nervous for her. I know both Shane and Ellie, so I'm quite excited. Shane looked quite worried, actually, which I was surprised. Every time I've seen Shane, he's very chilled. Everything's very calm and collected, but he looked a bit stressed today.
I'd say Ellie's played it cool right up in the last couple of hours.
And now she's just lost it.
Yeah.
Nah, she'll be fine. She's an A&E nurse, she's got this.
Yeah, exactly. No, she'll be fine.
I wonder if they've had much to drink this morning.
Hey! This is what we go through, lads. I'm really looking forward to seeing Shane. I think it's really nerve-wracking for him. I've got everyone around me, fussing over me, you know, and he's got a lot of thinking space.
I was nervous this morning, but now confident, I'm happy. Marrying the right person. First day I met her, I was like, yeah, I want to spend the rest of my life with this woman. She's kind, she's caring, hard-working. She's amazing.
I'm going to put it on my story later.
That's Shane, it's cool as a breeze, having a pint.
He didn't look calm earlier. He looked as white as a sheet earlier.
Right, guys, we're going for it now.
I feel like I'm going to cry already.
My mum's there, Darren, Luke.
I don't know if I'm going to cry. I will try not to because I don't want to have to redo my makeup.
I've been known to get emotional at times. I think I'll hold it together today. I think I should be okay.
Kevin will definitely cry. I'm going to have tissues in my bag, especially for Kevin.
With everyone nearly in position, including nervous fiancé Shane, it's time for the bride to make her big entrance.
Okay, Jazz, what's happening? What did the doctor say?
Back at the hospital, it's the final week of student Jasmine's 6-week A&E placement.
So this one here, this one is the water, so it's humidified there. Okay. And this is the temperature of this chamber, 37.1. All right?
Nurse RJ has been showing her the ropes, and it's been a steep learning curve since first stepping foot into the department.
So it's one each.
Oh,
So
okay.
it should be one
So
here.
it's not like different colour shades?
No, no.
A&E is overwhelming, and I think in my first few weeks it was crazy, but when I got used to it, I felt, okay, this is not as crazy as I had anticipated it to be.
6 weeks in at the deep end has raised her confidence. Now she's working with the pros and the most seriously ill patients in Resus.
Jazz, come to me and we'll do the triage for the
Okay.
medication.
Yeah.
Okay. With our symphony.
It's this one.
So you know what to click.
Let me remember. Getting this experience in Resus, I think, is really good to have as a student nurse.
So what kind of blue light is this?
Pediatric blue light.
So you start with that.
It's nothing like the wards. It's a completely different thing to anything I've experienced so far as a student nurse.
Patient accompanied by mom. It's just the same, but we just have some additives on it. Like
RJ will be putting Jasmine through her paces to make sure she has all the skills she needs, so he can sign off on her A&E placement in the future.
blue light to amber Resus in 2 minutes. Thank you. Jasmine, take this patient in Resus 2. So it's a period of unresponsiveness, this one. Blood pressure is low, GCS of 13. So you know the drill.
Yeah.
Are you okay?
Yeah. Oops. So I've got a patient with reduced consciousness coming in.
Jasmine's patient is expected any moment. Time to get prepared.
I'm getting ready the bits that we need to take bloods and cannulate from a patient. Swabs, OBS chart, ECG, gown, and all my wires are untangled. Reduced consciousness? Is that? Okay, yeah, that's fine, that's him. Hello, my name's Jasmine, I'm looking after you now. Nice to meet you. Can I check your blood pressure?
While Jasmine leads the way on settling the patient and getting observations, this allows the other nurses to consider the rest of his care.
This gentleman into episodes of unresponsiveness, slump on the left, but there's no facial droop.
Can I do a swab of your nose? I've got a swab in both nostrils, okay? I'm just comfortable with that process of the patient coming in by ambulance. You do their OBS, you look after them with the registered nurses, and I sort of know, depending on what they've come in, what the plan for the patient is. I need to check your eyes. Can you open your eyes for me? R2 is someone who's come in with reduced consciousness and a collapse, so the level of consciousness has actually changed. When they found him on arrival, it was quite low. He wasn't really responding much, but since the ambulance brought him in, he was more alert. In the next 10 minutes or so, it's gone down again, so the patient is in and out of consciousness. I put Obo's commands. He does a little bit, but slowly.
So GCS, is he talking?
No.
So how do you know he's going to...
With the patient's consciousness levels of concern, Jasmine turns to experienced staff nurse Martha for some pointers to make sure he's assessed correctly.
So he's not, is he making any sounds?
He was doing a little bit of, but now he's not. So Martha was telling me about the GCS, which is how we monitor levels of consciousness.
GCS stands for Glasgow Coma Scale, a universally recognised measurement of consciousness within medicine.
And then when you say follow commands, what commands is he following?
Ask him to hold up his arm.
But that's if you just hold his arm and let go, he's holding it up.
Yeah.
But that's not...
We monitor the best eye response, best motor response, and verbal response. So if the patient is able to follow commands, like open your eyes for me, if they open, then that's a mark. If they're not able to, that decreases the score. Can you open your eyes for us? Fine. It's just good to see everyone's different way of doing things. And as a student, you pick up bits from everyone, you put all your pieces together, and hopefully you get it right. Where's my score?
So every shaded box is a score.
Like 3.
So that's one each.
Student nurse Jasmine is on her final day of A&E placement and has been spending the day in Resus.
I'm actually working with RJ today for the first time in ages, and yeah, we're going to do some of my books.
As part of her training, Jasmine has a list of modules she needs to complete before she's finally signed off.
Read the notes, I'll give you time, and then discuss the patient to me again. You know the drill?
Yeah.
Yeah? All right.
He's just asked me to make sure I know my patient and do a practice handover with him. So in the proper way of SBAR, which is the situation, background, assessment and recommendation for the patient, which is what I'll be practicing with RJ. That's important so that you make sure your communication to each person is accurate and it's organised, just so you don't miss any information.
With the gauntlet set, it's time to see if all Jasmine's training has paid off.
Discuss the patient to me now.
She came in with difficulty breathing and a cough. She had a temperature, but when she came in, she was afebrile. We done the bloods and the bloods were fine, but clinically, she doesn't look like she's coping well.
Yeah.
There's so much that I want to do in nursing. I've not only just wanted to be an A&E nurse, I wanted to be a Northwick Park A&E nurse. Her work of breathing is increasing, and the concern is that clinically she's getting worse, even though on CPAP, so the recommendation is that we transfer her to St Mary's for increased level of care.
Can I just tell you something? You sounded so different from the first time I've asked you to do the handover to me. Like, you know, you have improved a lot.
Yeah.
Okay, let's start with your pulse.
Okay, so that was the first week.
During the first day, when I was asking her, tell me about your patient, so she really knows what she's talking about, but she's not really sure. I told her, tell me the details with conviction. You have to know what you're talking about. And I think the difference is that she knows what she's doing now. She has improved. She has followed a certain flow on how to hand over patients. She has a certain flow on how to assess the patient when the patient arrives in A&E. And I think that's a good sign that she will be a really great nurse in the future. Continue what you're doing. I'm really happy.
Thank you.
And if you got the chance, you can come back here and apply in A&E. If you want any recommendation, references, you can get me.
Thank you.
Take my number and you can give me as your reference.
Thank you. I think RJ is a big softie. He's strict, but I think he just wants you to be a good nurse. I don't think you'll ever stop learning as a nurse. From student to newly qualified, even if you're a band 8, I think there's always going to be something to learn because you can just never know everything. I've just been impressed by the sheer speed of how the emergency nurses get things done and how well they do it as well.
Nurse Ellie is moments away from walking down the aisle to marry her fiancé Shane. But the emergency nurses can't wait a second longer.
Everyone, can I ask you please to be upstanding for the arrival of the bridal party?
I will not be looking at anyone when I'm walking down the aisle. You look amazing. I'm going to be so nervous that I'm going to look straight ahead of me at Shane, hope that I don't trip up, get to the end and sigh with relief. But I do think there might be a few tears from people that I wouldn't expect.
Thank you all for being here today to show your support and to help Shane and Ellie celebrate this, their wedding day. Shane, do you take Ellie to be your lawful wedded wife?
I do.
Hang on a minute. To be loyal, loving and faithful to her for the rest of your lives together. So Ellie, you know what not to do. Ellie, do you take Shane to be your lawful wedded husband, to be loyal, loving and faithful to him for the rest of your lives together?
I am a bit in denial that I'm getting married today.
Mr. and Mrs. Warwick.
She looked amazing, she looked stunning. Shane messed up his line. I think he got too nervous. He was like, he was already shouting, I do, before she'd finished her sentence.
It was
the perfect ceremony. It had like a little bit of laughter. This was lovely. She looked so beautiful.
And I said I wouldn't cry. I did cry.
Who cried? The two of us cried. Yeah.
I love the tiara. I reckon we should have tiaras in work, don't you? Princess.
It was such a lovely ceremony. Did you cry? You cried. I know you did.
You look so nice. Let me see the bed, let me see the bed. Ah!
Guys at the back, if you come in a bit. This is me here in America now, and behind me is my new workplace. So yeah,